So today I've gathered y'all today at the City Council to discuss the childhood obesity epidemic which is plaguing our city. So a recent study reported by the CDC said that about 65% of Baltimore residents are overweight and about 31% are obese. The CDC says that about 1 out of every 3 children are considered overweight or obese. Children who are obese have a higher chance of developing chronic health conditions such as heart disease, diabetes, and low self-esteem. These health conditions are associated with high healthcare costs and frequent hospitalization, which is not good for the child's health. So some causes of this can range from malnutrition, poor education, genetic factors, and environmental things. So children who are typically born in communities with a lower socioeconomic background are at higher risk at becoming obese. So an interesting fact is that this generation in Baltimore is the first generation to be less healthy than adults. Now, City Council, this is not good statistics that we're hearing, so I've gathered you all here today to discuss possible solutions to fix this epidemic. So first we'll be hearing from Cameron.
What's up, guys? My name is Cameron Sadiq, and I want to talk to you about my policy proposal to help integrate healthy cafeteria foods, healthy vending machines, and healthy snacks into our Baltimore public school community. Now, a large drawback of the recently passed Healthy Hunger-Free Act is that it's implemented on the federal level, meaning it needed to be very one-size-fits-all. While working at the local level to do this will help tailor this policy specifically for Baltimore's food availability, economic conditions, and population. The policy itself would involve setting nutritional standards to allow schools to serve certain foods and drinks in their premises. Further, it would involve child health experts coming to the schools in order to audit the school cafeterias and the foods being served periodically, ideally on a monthly basis. In doing so, I believe that this policy will help combat childhood obesity by both preventing it and treating those who are already suffering from childhood obesity. Next, you'll hear from Sofia about her policy.
Hi, my name is Sofia, and I am here today to talk about another policy recommendation regarding obesity. Assuming obesity affects mainly people of lower socioeconomic status, it is important to talk about the tackling of food deserts as a means to provide more accessible, healthy options to households. One way to tackle this problem is to tear down some of the empty buildings located in Baltimore and create local gardens where people can cultivate their own vegetables. Each person who lives in the neighborhood can have access to a certain amount of food in that garden by being assigned a specific amount of square feet. People who will be in charge of maintaining the garden will be members of the community and will have a bigger portion of the food outcome available to them. This policy can be very effective because essentially no one is being negatively affected by it. The reason being that most of these houses that were to be torn down to create local gardens are derelict buildings confiscated by the government. As a result, there will be no ownership problem that needs to be addressed, making the program very realistic to implement. This option is finally very cheap because the only funding that will be needed for this program is to demolish the buildings and then providing the necessary crops to cultivate the garden. Next, we will hear from Raj, who will recommend another policy option.
Hello, ladies and gentlemen. My name is Rajiv Ayagari, and I am a City Council member. Right now in Baltimore, we have a crisis of obesity. And while diet and the type of food you are receiving does affect physical obesity, it is also important to have physical activity. In order to create an atmosphere of physical activity in Baltimore, I believe that it is important to improve our local community jungle gyms and play areas, renovate the basketball courts, and create mandatory physical education in the schools. Now, this might seem like a wide-ranging series of social programs, but I believe that they are all needed in order to foster habits in these children, habits of physical activity that will carry them through their lives healthy and fit. Experts recommend 150 to 225 minutes of exercise per school week. That's not a number most Baltimore children meet, especially among low-income areas. This lack of physical activity exacerbates problems already formed from poor diet and lack of access to credible food. Running, the most common of exercise, is not available as a feasible technique because of the lack of good roads. It's important to renovate playgrounds and other areas where physical activity is feasible. And the funds that come from this come from the TIF fund, a fund that's put aside from every fiscal year in order to renovate the parts of Baltimore. This fund can be used to renovate our playgrounds, create new programs of physical activity, and create mandatory PE programs. Politically, Mrs. Mayor, this could be a great gain, as it could show that you are interested in the youth of Baltimore and are invested in creating a healthy future. The only people this harms are those who aren't willing to exercise, and as we all know, children want to run and play. I hope that following this program, we can create a new generation of healthy, fit adults in Baltimore from the youth of today. Signing off, that's Rajiv Ayagari. Now, to speak with us about classes in the school concerning nutritional education, we have Mariana.
Hi, my name is Mariana Lordo, and I'd like to present my policy to improve childhood obesity in Baltimore. So, one of the major problems concerning childhood obesity in Baltimore is how to implement a high-quality course of study in health and physical education. In order to meaningfully affect childhood eating habit, classes should start to include nutritional components that teach children how to eat healthy. This nutritional education class would focus on how to practically teach children and adolescents how to prepare healthy and affordable meals from their environments. Too often, parents default to unhealthy fast foods because of financial or time constraints, and this policy will help reverse that effect. Schools will need to budget their finances in a way to accommodate an extra hour of school at least 3 days a week. States should alter their legislation regarding education so as to require public schools to implement the nutritional education class and provide compensation to teachers and the professionals who take on the extra hours to teach it. The curriculum of this new class must meet all state and national health education requirement standards. Classes should teach not only what healthy behavior looks like, but how to implement it, and thus provide ample opportunity to practice that behavior and how to overcome any barriers to adopting such behaviors. I believe this will be effective in the long run, as it teaches kids how to cook healthy and balanced meals and how to live a healthy lifestyle without relying on their parents. Now our Mayor Jen will decide which policy is the best to effectively improve the condition of childhood obesity in Baltimore.
Hello! Thank you for watching our City Council members give their take on the best policy alternatives to combating childhood obesity. So, personally, I thought that the policy given by Sofia was the best one. I think this is because this alternative will not only help low-income families, but it will also incentivize them to eat healthier and integrate a different kind of lifestyle into their everyday routine. This recommendation is very realistic and can be executed within a short period of time. Since it is also very inexpensive, it is very easy to implement and doesn't require plenty of resources or lots of state funding. I hope this was helpful, and thank you for watching.